Hello, my name is Dr. Trent with Tricare Chiropractic. Today I just wanted to give you a quick tour of our building that we're in that share with other professional doctor offices, and also at the same time just kind of like what to expect if this is your first visit. As you walk in, we have a beautiful waterfall here. We have a pharmacy here. We have a neurosurgeon right here in his offices, Dr. Jacob Rosenstein. And then basically if you turn here, we have a little banner and sign, so therefore that you know you're in the right location. As we go in, we have Dr. JD offices right here. He's a psychiatrist, and our office is right here on the left-hand side as you walk into the building.
Oh.
I have a little sign here that basically so you won't get lost. Our office hours here, we open late evening till 6 p.m. Monday through Thursday. This is our reception area here. We are very, like I say, inviting. At the same time, we want you to bring in your kids because we understand that sometimes that, like I say, it's not possible for you to set up a daycare arrangement. So like I said, we welcome little kids. As a result, we have a little toys area for the kids that they can come in, basically play with some of the toys or read some of the books. We also have a little tabletops here for a lot of spouse that wants to come in, basically do some of their work. They can put their laptop on top of it, utilize our free Wi-Fi and everything like that, and get their work done. But as you can closely see, this is our reception area here. So for a new patient, basically as you walk in, our lovely staff, we introduce ourselves and just give you a few paperwork so you can start filling out. Once the paperwork is filled out, she will prepare a folder and then basically give it to Dr. Trin, so Dr. Trin can take a look at it, and Dr. Trin will come out and greet you here. So this is our reception area, and this is where you're going to check in, and Elisa is our front reception. She's going to give you all the information, and as you walk in, on the left hand side we have two traction table. The first one that we utilize mostly for our patients is to help restore the curvature, but also for this device right here, we have patients with severe neck issues where they're basically looking on the phone a lot, texting a lot, computer work, where they lost their neck curvature. So we have a device to help try to restore the curve back, and that's very important here. As you can clearly see, we have patient of the month for this most recent month, and like I say, that's what we do. We're really proud to be able to get a lot of patient feedbacks on how we have helped them with the quality of life, to be able to work better, be able to be more productive at work, not missing a day of work because of neck and back problem, but also more importantly, how they're going to be able to take care of their kids at home and also be able to enjoy a lot of family fun activities and not being so much in pain and irritable by the time they come home from work. But more importantly, house chores in the weekend, they're able to tackle those activities and also at the same time not hurting so much. We have a little rehab area here where we do a little bit of low back stretches, simple TheraBand exercises, simple weight exercises, neck bar exercises for the neck, for the upper back area, and also for the hand. We have a lot of tools that we use that's very simple. As a result, some of those tools that we're going to teach our patients how to stretch properly. As a result, they can also continue this at home. We have a lot of back support for sitting properly. We have a fit ball that allow our patients to, at the same time while sitting, to work on their core muscle and everything like that. We have a recumbent bike for patients with ankle problem, with knee problem, with hip problem, and also helps circulation and everything like that to start out their exercise with. This room is our stimulation room. We can do two patients at the same time. The purpose of this room is to help swelling and also help muscle spasm, also help patients with neck and back problems. So we utilize this room. For a lot of patients with muscle atrophy, we can do Russian stem and everything like that. We have two massage rooms. Pearl is our massage therapist. She's massaging a patient right now. And here's our other massage room. Very, like I say, very comfortable, spa-like setting and everything like that, so our patient can be at ease and extremely professional in this professional environment. Now, what I really wanted to show you now is that we start doing a lot of nutrition, and the company that we utilize is Standard Process. What makes Standard Process is so unique is that they have an organic certified farm up in Wisconsin. I believe about almost 400 or 500 acres of it. and most of their products that they carry are from veggies that they grow. As a result, they're able to process it in a way that keep all the minerals, the nutrients, and the vitamin to be able to give optimal support for your organ issues where you may be suffering from heart issues, kidneys issues, depressions, other health related issues that you may be experiencing, stomach problem, that we can probably help by giving you proper nutrition, so therefore your body can start healing and also start repairing itself. As you can clearly see, that's the product that we carry. We carry standard process, and some of the herbs that we carry are from native herbs. We are very big in nutrition, so what we try to do with our patients is educate them about how to eat correctly. As a result, a lot of the studies out there right now, for instance, the documentary Forks Over Knife, What the Health, related to a lot of the stuff that we are experiencing or having problem with, can be resolved or reversed just by having proper knowledge on nutrition. Here also as well, and as you can clearly see, we utilize inversion table. Inversion table are very beneficial for patients with low back problem, but at the same time, a lot of patients do not know how to use it correctly, or some of the health condition that they have with their back or their spine may aggravate it with inversion table. So if you have any question to see if inversion table can be a very benefit for you, just give us a call. I can basically sit down with you, see what's going on, and basically give you a consultation to see if this inversion table would be beneficial for you. This is my office right here. This is also my consultation room, my report of finding room, and my treatment room. As you can walk in right here, we have a special table. So for patients with severe low back pain, they don't even have to bend over. They can just walk up, and then basically this table goes down. Many of you guys are wondering what kind of technique that we utilize. Depends on the condition. So it depends on certain condition and certain preferences. Not every patient will get the popping and twisting technique. We utilize a special table that adjusts without twisting or popping the neck and the back. Or we have another device called an activator. An activator is another way of aligning the spine, taking the pressure off the nerve without the twisting of the neck or the popping noises of the neck and the back. So it depends on the patient conditions, and also depends on the patient x-ray. We don't take x-ray here. We refer our patient out for x-ray, and the main reason why we do that is that a lot of time, in fact, we have a patient that came in with severe upper back pain, and because of that, we refer the patients out for an x-ray to this imaging center about 5 minutes from here. They can take the x-ray as you just walk in. You don't need to make an appointment. And because they have a radiologist on staff, the radiologist read that patient's x-ray of the upper back area and found out she had breast cancer. As a result, because of that, like I say, we might overlook that. And if we don't review x-ray, and look besides the spine, we may be missing that. So because of that experience, we refer patients out for x-ray, and with the radiologist read it, they also be able to find out what else is going on with the patients besides evaluating the spine. So when we refer a patient out for x-ray, the patient get a copy of the films, and this is what the films will look like. And basically what we do is we'll review it and then let you know exactly what's going on. If it's a situation where it's related to musculoskeletal where we can help that patient, we will let our patient know that they'll be able to help. And if we'll be able to help, we will let them know what kind of session is necessary to get them stabilized. So this is how an x-ray will look like. So what I do in my office here is I will evaluate the patients and see what's going on. If it's a condition that we can help, we will let them know exactly what kind of visit is necessary to stabilize their patient's condition. Depends on their neck or their back problem. As you can clearly see, that's our office, and like I say, we wanted to invite everybody to come in. Any question that you have, you can always come in for a free consultation. There's no charge to get an opportunity to sit down with me so I can review some of the history, and then we can go from there. Thank you for the tour.